Welcome to the Heart of Giving. As you know, our programs are all about nonprofits in the community, the thing that gives our city its soul. Today we have a very special program. It is about a nonprofit, but many people don't think of it maybe as a nonprofit, but it is, and it's probably the biggest one in the city. And we have today Diana Hindle, who is the CEO, head, administrator, whatever it is, of Memorial, Miller's Children's, and community hospitals. And I know it's much more extensive than that, Diana, and I'm just so proud of what you're doing. You've just done such an outstanding job. But let's talk first about what makes it nonprofit. Let's start there.
Well, what makes it nonprofit is it's core to our mission. So for more than 107 years now, we have served the greater Long Beach area and their healthcare needs as a not-for-profit. What that means is that regardless of age, gender, ethnicity, religious affiliation, languages spoken, and most importantly, socioeconomic status, so meaning the ability to pay, we serve everyone. So we consider everyone in Greater Long Beach our members, if you will. And so our goal, our mission, is that we endeavor to be able to serve the healthcare needs, both acute care needs, outpatient needs for anyone, even if they aren't able to pay. And it's something that's core to who we are. And
it didn't start as Memorial. What did it start as?
Yes, it actually...
Because I know it very well.
Yes, you do. It actually started at Seaside Hospital on the west side of Long Beach. Was born in 1907. It moved to its current location, which at the time was thought to be way out in the outer skirts of Long Beach.
Is that right? When was that?
In mid-1950s, long before the 405, but just as the 405 was being dreamt up. And so thought to be an ideal location for health care. We were able to secure, 54 acres. So Long Beach Memorial moved to its current location, late 50s. It expanded in 1972 to add Miller Children's Hospital, and that was a result of a grateful donor, the Earl B. and Lorraine H. Miller Foundation, helped us to establish a separate hospital, Miller Children's Hospital. And then, as you know, Community Hospital, which is on the east side of Long Beach, actually started 90 years ago, in 1924, and it joined our health system 3 years ago.
I think we'll talk a little bit about that sometime during the time we speak, because that was such a major move, and it's turned out to be such a wonderful combination of services. I mean, taking each other as strengths, and I really just noticed what a change that's been. It's just been a marvelous thing for all of them.
Really.
But now talk about what Memorial does, not what it does. Where are you in the city? I know you're those three main places.
Well, we're just south of the 405 freeway. We're along the major corridor on 54 acres. Long Beach and Miller Children's, two separately licensed hospitals that are really quite large, amongst the largest
and the Children's Hospital was redone in the last 5 years.
Yeah, we continue to expand. We added a new pavilion, about 200,000 square feet. So continue to expand to meet the healthcare needs for really a large population of children in Greater Long Beach.
And the healthcare services that we provide are part of a larger Memorial Health Services.
Yes.
And tell us about that, because it is we don't stand alone.
Absolutely. We're really proud to be part of the Memorial Care Health System, which is a not-for-profit, of course. It's our parent corporation. It operates 3 other hospitals in Orange County, as well as has developed an entire integrated healthcare delivery system. So beyond being acute care hospitals, or even a collection of acute care hospitals, we now have a very integrated healthcare delivery system that includes medical office practices, outpatient centers, outpatient surgery centers, imaging centers, a very thriving medical practice, as well as having newly launched our Seaside Health Plan.
But there are locations that, to be specific, the one on Bellflower that's new.
Yes.
Now tell me about those things like that in the community.
Very much to the point of it being an integrated delivery system and beyond just the acute care hospital. Los Altos, which is on Bellflower Boulevard in that Stern Shopping Center, so a great access on the east side of east side of Long Beach. It's 30,000 square feet. It was opened just a little over a year ago. We have 20 physicians, new primary care
20
physicians.
in there.
Yes, many of whom have graduated from our family medicine residency program, and so have formed this very solid primary care service. And you know, in Long Beach, we have a shortage of primary care physicians.
Yes, family services.
Yes, absolutely. And so being able to launch that program, add that service to the east side of Long Beach is really important to
And it's been
our
very
mission.
successful.
Very successful.
And there's parking.
There's parking. It's a lovely setting. It's fully integrated from an electronic medical record perspective with all of our other services. So a patient seen there who also then needs to go to the hospital or one of our other centers, all their information is seamlessly available. It has urgent care services, so it's a great addition.
And just talking about that, you hit on the point of the electronic system that you have. Explain what that is.
Sure. Well, we were one of the leaders. In fact, we were probably amongst the very first in the nation to go live and implement an electronic medical record, so meaning an online medical record. It was called Epic.
Yes.
And we launched it in 2008. Both at Long Beach Memorial and Miller Children's. We'll be launching it at Community Hospital this fall. And what that allows us to do is transform what was previously a written medical record into an electronic format.
So if a doctor saw a patient, instead of writing it out, it goes into a system.
Absolutely. Which allows other doctors to be able to, one, read each other's writing, but also be able to access that record from remote locations. So long gone are the days where a medical record, a written medical record, has to find its way from clinician to clinician. Now, if we have an on-call physician at home who is called through an emergency department, they're able to get right on at home, see that patient's record, and provide consultation or advice to the emergency department. So just a tremendous addition, and we were one of the leaders in implementing
Yes, I know, and I remember when it started, you know, and it was like, what? How do we do this? You know, the doctors were looking at the machine. And,
yes.
But now the medical records are accessible if they're on vacation.
Absolutely. And now accessible to patients. We have a module called MyChart, and so patients themselves can have access to their lab data, to their medical record from their own homes. And so that greatly improves the engagement and involvement of patients with their own health care.
Well, there's so many things going on. The urgent care now, it's always been at community. You have urgent care there. You have it also at Memorial Hospital. And urgent at the one on Bellflower also?
Yes, absolutely. So, and that has, since its beginning implementation in January of 2012, boy, that's really been something that's added a lot of value to our community.
Well, you know, the thing that has been impressive, I think, to all of us that have watched Memorial grow and have all of these excellent strengths that has been added to the core of what they all do, really, and the coordination of it. But in addition to that, there have been so many things that have happened on the Memorial Hospital campus.
Yes.
I keep thinking it's a college.
Yes.
But you call it a campus. Yeah, on that campus that has shown the growth and the future, really, rather than just still being with the same things that we've always had, but the future growth and a lot of buy-in by the community. So tell me what those are, because it seems like I see them, but I don't know what they all are part of.
Well, gladly and proudly. They're really rooted in two things. One, we mentioned the long-time legacy. So we have a long view of providing care in the community. Secondly, the not-for-profit. So we're always looking at how we can serve more people. And what's really fascinating is with having that long view, our ability to implement both short-term strategies and long-term with that mindset of it being not-for-profit, it being a legacy for hundreds of years into the future, allow us to look well into the future. And so to the point of what new services, we have recently completed our Todd Cancer Pavilion, We are
That
on
was
the
named after the
Malcolm Todd.
Malcolm Todd.
Yes, and it was from a generous gift, a donation many years ago with his vision to consolidate the outpatient services.
Wasn't he president of the AMA once?
I believe he was,
Yeah,
yes.
I think so.
Yes, he was really quite a legend and someone who we were really fortunate to know and learn from, and really graced with his vision of the future.
And his son went to Long Beach City College. Yes. I remember that.
Yes, and he remains very active with our advisory board. So we're really fortunate that that's a perfect example of families who continue to give back and remain connected to the organization.
Okay, finish about the
So,
Todd Camp.
sure,
I got you off
absolutely.
the story.
Well, it's a beautiful center that opened last summer, and it allows us to have created a very warm, healing, comforting environment for patients who have cancer diagnoses, so that
Men
they can
and women.
Men and women, and they can receive their treatment and therapy in a really soothing environment, one that is entirely devoted to a patient who has cancer. And it goes beyond just the technical or medical therapies, but also the holistic, the spiritual needs, nutritional needs, physical needs, and others, so that we're incorporating an entire body focus. And for that person's family, because we know that when people are diagnosed with cancer, it affects their family, of course, as well. And so implementing more services to reach in and incorporate the family is really important.
And this is a coordinated care, so that the doctors, all of them know where you are in the spectrum of things.
Absolutely, and that was the vision, that it would come together in a coordinated fashion with all caregivers, certainly our physicians and nurse navigators, pharmacists, nutritionists, our spiritual
That's very
care.
good, because you know, it was that you would go to this doctor and have to take the x-rays to go to the next doctor, and so this is coordinated in one location.
Yes. So
And it just opened,
it opened last summer, so almost a full year.
and it's been successful.
Very successful.
Very
yes.
good.
The feedback from our patients, from physicians and others, our community members, boy, they are grateful for that additional service. So.
And tell me, now that's the Todd Pavilion, but there are others.
Yes, in fact, I'd mentioned earlier that we had implemented a 200,000 square foot medical pavilion for pediatrics for Miller Children's, and it's a state-of-the-art center that has both an outpatient imaging, so X-ray and other things like imaging.
Where's that going?
It's currently in our new pavilion that was opened just a few years ago.
Oh, in
yes,
that,
in that pavilion.
I know exactly.
But it also allowed us to build 7 state-of-the-art, technologically advanced operating rooms specifically for children. So many people may not realize that it's very specific for children. Also, we added to our neonatal intensive care unit and opened 48 new, just beautiful bays that allow for a lot of privacy with family members when their children need to be cared for in our neonatal intensive care unit. And then on the 3rd floor of that same pavilion, we developed a 24-bed hematology oncology for children with cancer. So.
You know, I think that particular hospital is, what's the word I want? I think that it's not really recognized for what it is, because I think statewide, how many children's hospitals are there? 8?
There are 8 standalone children's hospitals.
8 standalone hospitals. And what we do in ours in Long Beach, I think, is so extensive, actually, compared to the others, the other 8.
You mentioned it really is the best kept secret. That Miller Children's Hospital, as you mentioned, is one of 8 standalone, freestanding children's hospitals specifically devoted to specialty care for children with acute illnesses or chronic illnesses.
And for newborns.
Newborns. It also incorporates our high-risk perinatal program.
Yes.
And we have more than 6,000 babies that are born at Miller Children's, which is an extraordinary number. Most of the children born don't require additional care, but we're right there as a children's hospital for those children that we know are going to be born and need additional care right at delivery.
That's right.
So,
well, in addition to that, being as we're talking about children, the Ronald McDonald House that we have in the city that was actually, I think, built by volunteers in the community, because
Entirely.
some of the people in the city that just lived and breathed it until it was done, and getting funds and making sure that everyone knew what a marvelous addition this was. And it's, I think, constantly full. It's a place where families can be so that they can be close to their children. Even their other children can be with them. It's a marvelous addition to what the hospital is doing.
Yeah, it is just a wonderful example of when community members come together and provide a service, provide a healing, warm, welcoming location.
Yes, that's right.
Because certainly we experience and know that when parents have to have a child in the hospital, that can be
Traumatic.
absolutely traumatic. And so to have a welcoming environment, one where you're surrounded by people who understand what it's
Absolutely.
like to have a child
Absolutely.
in the hospital. It's located right on our campus, and just a great example of a group of people coming together purely out of the love of providing a service that previously wasn't available.
And what about the other pavilions or plans for that you have for the location memorial?
Well, continuing on the Miller Children's and its expansion, we've just started a 3-year project to completely renovate our pediatric intensive care unit. We're one of the largest pediatric intensive care units in the greater region. We'll be taking our 3rd floor of what we call our Heritage Building and completely renovating it.
And what's the Heritage Building?
And the Heritage Building is the original Miller Children's Hospital. So we've been able to continue to refurbish, but also expand. So the pavilion was a new addition, but we were able to maintain and retain the original Miller Children's Hospital. And now we're in a position of refurbishing it and remodeling it and bringing it to state-of-the-art. And so the Pediatric Intensive Care Unit will have 30 beds. It will have rooms that, beyond being technologically advanced, will have more space for families, have private bathrooms for the family members, pull-out beds, so that family members can stay right with their child if they need intensive care services. So,
do you have other things that are going?
I mean, many more.
I know.
We'll be proudly announcing soon. I'm really hopeful that it's this summer. A 70,000 square foot, so very large outpatient village, we're calling it, and it's for our pediatric specialty center. And so
Just for children?
Just for children, and just for children's specialty services.
For outpatient services.
In fact, more of our
think
services
that's-
now
For
are
outpatient.
for outpatient. We serve care for 100,000 children in our outpatient specialty clinics each year. And so
Do you have an outpatient for adults?
we do have
Centered?
outpatient. Yes, we do. It's in the Buffum's Pavilion, and again, a nod to a previously grateful donor, the Buffum's family, and it houses our family medicine program, and so we have outpatient for adults as well. We're really full service. I often say we care for people even before they're born, and as they pass, and even beyond. So it's really a privilege to be able to care for people at all stages of their life and all of their needs.
Well, it seems that just in what you've said, and then other things that I can remember hearing about, you're going to go across the street, across Atlantic for something.
Yeah. Very likely to be our outpatient village.
Oh, the outpatient village,
Yes,
okay.
We'll bridge across
Okay.
and just create a much, even a stronger feeling for Miller Children's Hospital, and that visibility and the campus feel, to your point on campus.
And you've started some programs, there have been many programs started at community, but one of the things that has happened since they are part of Memorial now, are some of the specialties they have that has complemented what's already been happening elsewhere.
Yes. And complement is very much the word. As you know, Community Hospital has long served people on the east side of Long
absolutely.
Beach. You were instrumental in helping it to stay open. It cares for more than 2,000 patients through the emergency department, so a much needed service. It also cares for a large number of patients with medical, surgical, or intensive care needs. But what's really unique about Community Hospital, and where the complementary aspect came in for us, was the mental health and wellness program. And community had established mental health and wellness over the years, but coming together with us and aligning with the community needs, we've been able to expand those services greatly, both for outpatient, but also people who need inpatient care, and across a larger range of people who have mental health or wellness issues. So geriatric patients, we've expanded that for our outpatients.
I think they need geriatric services. Okay,
absolutely.
Close to home.
Well, women who've recently delivered babies and postpartum depression, that's been a high need in our community. And then really coming full circle from a complementary perspective is the need for adolescent psychiatry services. So as part of Miller Children's. So you can really see the tie of the three hospitals and how the inner workings,
it's marvelous.
Both for now, but well into our future. So very exciting for us.
Well, you know, in addition to the facilities themselves and the services they provide, something that has been so surprising to me is the change that happens with the equipment dealing with patients.
Yes.
Like the Da Vinci.
Yes.
You know, there was another one that was brought in that you just wonder you wonder at how this can happen.
Sure.
So it isn't just taking care of the facilities and the problems, but taking care of the problems in a brand new way. So why don't you tell us just about a couple of them?
Well, I think you've raised a really good point that we endeavor to stay state of the art, so that we want to always be implementing technologies that have the ability to help us practice medicine even better. So the Da Vinci, which is a minimally invasive robot, we really led the way. In fact, the vast majority of cardiac surgeries that are done robotically.
Yeah,
I think we're the largest
provider. The doctor is here with the computer and the machine, and the patient is over here, and you know exactly what's happening.
Yes.
And I mean, it's mind-boggling.
It is really, truly. It's an advance that allows many patients to not have to have full open heart surgery, and instead many smaller incisions, so much less invasive. But what also is unique is that it takes any tremor of the surgeon's hand, and so the precision
That's what I mean.
is much more accurate.
Absolutely.
Yes, so the speed to recovery, the number of days you have to stay in a hospital.
The opening up, it doesn't happen.
Risk for infection or blood loss, any of those clinical indicators really are minimized. And so that's a perfect example of a technology that we study, and in fact we study in collaboration with our medical teams, and in really important to implement programs that are going to serve people even better into the future. So we constantly are looking down the road from a technology perspective. We won't chase esoteric technologies just for the sake of bragging rights.
No.
We're going to pick, as a not-for-profit and as a community member, we're going to select those technologies that have the potential to do the greatest amount of good for the greatest number of people.
And also you have to be very selective, because all of this new equipment is so expensive. I mean, and that's why hospitals really can't afford to have some of these things. We
must be really wise stewards of those resources and ensure that we're investing them.
There was another, not a machine, another instrument that has just, that the hospital has just recently,
yes, probably around radiation oncology. Radiation oncology, our ability to either do photon or proton, so that we're cancer patients able to direct a beam of radiation even more intensely and really accurately focused on a tumor without collateral damage, so that we can give the highest amount of radiation without injury. So those are advances that we continue to pursue as well. So
that's wonderful.
Those are a couple really good examples. But
now, where did you come from, Diana?
Well,
I mean, you've made an impact on Long Beach, not just a memorial, but as an active participant in the community, and really become part of our life here. So where did you come from?
Well, I came from Long Beach, actually. I was born at St. Mary Medical Center, and I really am fond of saying I was born at St. Mary, which has a really fond place in my heart, and grew up at Long Beach Memorial. I've spent now 25 years at Long Beach Memorial and Miller Children's and through our Memorial
In different
Care,
positions.
in different positions throughout our health system. So actually, technically half my life has been spent working in Long Beach and really connected to that not-for-profit mission. And so to the point of why I'm really involved in community efforts is I love Long Beach, and I love what's so unique about this city, this greater region. And so to be able to be really involved in helping to make things better, helping to impact people's lives is really important to me. So.
Well, of 25 years at Memorial, did you ever think when you started that you would end up being, and is it CEO?
CEO, yes.
CEO at Memorial?
Yeah. No, I had no idea. In fact, I can remember my first day. I started as a clinical pharmacy resident and nervously going down the escalator, and with the idea that it was a privilege to be there. Long Beach Memorial has an amazing reputation.
Stellar reputation.
And in the clinical pharmacy profession, it's top-notch. And so everybody wanted to practice pharmacy at Long Beach Memorial. And so when I finished my doctorate, I was really privileged to come back as a clinical resident. It was always my dream to come back to Long Beach and to be able to start there. My goal was just to be in roles or be in positions that allowed me to do the greatest good.
Well, we are so lucky to have you, and you've done just wonderful things in your tenure there, especially as CEO of all of the facilities. And your heart's in the right place, I can tell, for what you do. So I thank you so much for being here. It's been marvelous.
Oh, thank you.
I think we've all learned many new things in this particular production, and we're glad that you're here to hear about the nonprofits, especially the one today. Thank you very much for watching.